Dear Dharma Master Chen Yan, I'm very grateful for all of you coming here. It's my honor to share my my research on the coronavirus. I think the coronavirus um, is the most powerful disease epidemic in the recent year. All of us were very concerned about this coronavirus, and so I feel very honored to be able to share my research with you today. Sorry for the technical difficulties in the PowerPoint presentation. The coronavirus disease in 2019. The coronavirus was found in the last year, not December. It was found in the city of Wuhan in China, and the people were infected by they have the symptom of pneumonia, and the WHO at they got the informed from the China about got the report from the China about this coronavirus on December 31st. So the Taiwanese government and our the Taiwanese government, the Center for Disease Control, declared that we need to put the travelers in quarantine if they take the direct flight from the Wuhan. And in January of this year, the Chinese government already identified the DNA sequence of the coronavirus. And on January 23rd, because the severe outbreak of the coronavirus in the city of Wuhan, the Wuhan city government ordered a lockdown of the city. And in January, WHO named this COVID-19 as SARS-CoV-2. The virus was called SARS-CoV-2. So it indicates that this COVID-19 has relationship with it was evolved from SARS. On March 11th, WHO declared that the COVID-19 outbreak is a pandemic as it ravaged the whole world. So in Europe and Africa, the has very severe outbreak of COVID-19, and also the most significant severe situation in Africa, American, India, and Brazil. What is the COVID-19? What is the virus? Pneumonia was usually caused by the infection of virus or bacteria. What is the virus? Virus is the most simplest and life form DNA or RNA gene. They're quite different. The virus is quite different from the cell of the animals. They pass down the message of DNA in and the RNA only exists in the virus. They pass down the DNA message. The virus only has one gene, and the they pass down the message with the protein life sappers to pass down through the proteins. So virus cannot live alone. They have to depend on the cell of animals. So a virus causes a lot of illness, such as polio and smallpox and hepatitis, and also dengue fever, and also enterovirus and AIDS, and also the we are not able to kill virus. Our cells have to learn how to live in harmony with the virus. So the virus cannot be cured by the antibiotics. There are various forms of virus. There are Ebola virus. It looks beautiful. I think it's the most beautiful virus. It's the Ebola virus, but it's very deadly. The death rate is 95% if a person is infected. And you can see the other kinds of virus. So the measles, the first one is the measles virus, and the second one is tobacco mosaic virus, and the third one is the polio virus. And you can see the spike from the spikes from the coronavirus. And it looks like a crowd.
We can see this coronavirus has a lipid membrane on the outside, and covered on this membrane are spikes. And overall, it looks like a crown, hence we call it a coronavirus. So this came from the imagination of people before us. And it has a very special characteristic is that it has spike proteins. And these coronaviruses infect many different types of animals, such as pigs, livestock, cats, cows, dogs. They can all contract coronavirus, and these viruses can cause severe gastrointestinal and respiratory diseases. So, for people who raise livestock and keep pets, they need to be vaccinated. However, vaccines aren't very good because these coronaviruses from animals are very close to the coronaviruses that infect humans and that cause these diseases. And what's most special is that bats in nature carry a lot of coronavirus in their bodies. This is a very peculiar case. Most coronaviruses in different animals originally come from coronaviruses that we find in bats. Also, we see like the Ebola virus, it also comes from bats. So bats are very special in the animal kingdom. They carry all sorts of viruses in them. And the coronavirus that infect humans and the coronavirus that infects animals can infect each other. The animal viruses can infect humans as well. And our pets can also contract the coronavirus from humans. We are not sure, we haven't studied this very well in clinical trials, but we do know that coronavirus from humans can infect animals as well. We know that bats are the original source of the coronavirus that have infected humans. We see back in the 1960s was the first time that humans isolated the coronavirus that infected humans. This was the common cold. And this common cold is not very serious. So people were not very interested in studying the coronavirus a little more because people could get over the common cold pretty easily. But in 2003, there's another time when we isolated this coronavirus that caused SARS. Because I am a specialist in studying coronavirus, studying it for a few decades, I've never felt that it was a very dangerous virus. But in 2003, when I was having a meeting in Australia, I received a call from a reporter in the US about the SARS situation, and I was very surprised. But as time proved, coronavirus caused this very severe epidemic that was SARS, and it caused acute pneumonia, which is much more serious. It had a close to 10% death rate, so it was a very serious disease. SARS disappeared over a few months, over a course of approximately 6 months. It disappeared from the world. And in Taiwan, we had stamped out the virus over a course of 3 to 4 months. So us humans came out of that crisis. But in 2012, 10 years later, there was another strain of coronavirus that we call MERS. that emerged in Saudi Arabia, in Netherlands, and in Korea. And when this virus appeared in Korea, it was very serious. It was similar to SARS, but it had a 30% death rate, mortality rate. So it was very serious. MERS was very close to SARS. MERS stands for Middle East Respiratory Syndrome. So this disease originally came from the Middle East, but it affected Korea as well. Other countries did not contract this disease. We do not know the cause why this disease traveled to Korea. But this disease also disappeared over a few months until last year, December 31st, we discovered SARS-CoV-2. We can see that in the past, coronavirus had caused some diseases that we could still deal with. But this year, we see COVID has brought about a much more serious situation to the world. We see that the coronavirus comes from bats. We do not know why this is. Bats live in caves. They do not have direct contact with humans, and we have been able to coexist for hundreds of years. Now, when we go into caves and we see caves inside, and these bats carry coronavirus with them. However, they do not infect humans directly. These viruses need to go through some mutations. They go through intermediate hosts in the form of other animals before the virus can infect humans. When we were dealing with SARS, we discovered that the virus came to humans by the way of civet cats. And with a mutation in the genes in the virus, it became the virus that we knew as SARS. And the second time we had a big outbreak was MERS. The virus for MERS also originated in bats. It was then passed on to camels and then passed on to humans. So somehow, after bats came into contact with camels, the virus mutated its genes and infected the intermediate host and then infected humans. So we have plenty of evidence to show that bats are the origin for these coronaviruses, including COVID-19. And we think that the intermediate host for COVID-19 may be pangolins, monkeys, or possibly horses. So what process was it that allowed the pangolin to become an intermediate host? We still do not have a very good idea. There is still debate going on within doctors and academia. But we do know that the original source is bats, and that infected some sort of intermediate host and then infected humans. So we can see that these new coronaviruses have all originated from bats. And the question we have is, how is the bat able to coexist with all of these viruses? maybe bats have a very special immune system or a way of life. Say maybe because they can fly, bats are the only mammals that can fly. And flying takes a lot of energy. And perhaps in this expenditure of energy somehow prevents the virus from taking down the immune system of bats. So this is something for us to study in the future. How are bats able to coexist with the coronavirus? There are about 1,300 species of bats in the world, and over half of these species have coronavirus. So having so much coronavirus in their bodies and being able to infect humans and other animals, we expect to see more coronaviruses from bats in the future. And that is something we are discussing very closely now. So this is the basic construction of the coronavirus. On the outside, you see these spike proteins. And on the inside, this chain we see is the strand of RNA, ribonucleic acid. Coronavirus has the longest RNA in the natural world at 32 kilobytes. And this is a very interesting scientific problem. How is it able to have such a long RNA strand? And this is because when this RNA is being replicated, it is able to self-correct somehow. And this is a problem that we're still working on. So I would like to share with you today is that the spike protein on the surface of the virus, and from the standpoint of the virus, this spike protein is most important.
The spike protein has the power to determine what kind of cell will be infected. And the spike protein is on the membrane of the cell. So the virus, if the virus need to get in contact with the membrane of the cell, the spike of the virus is like the key to open the lock of the membrane of the cell. So the receptor of the on the membrane of the cell is like the lock. So the virus, the spike protein of the virus is like the key to open the receptor. So, and the when the virus spike protein get in contact with the receptor to open the membrane of the cell, and they will start to regenerate themselves and to in the cell of the animals. So if we wanted to find if we want to develop vaccines, we need to find out the key to why is the cause of the spike. How do we stop the combination, the fusion of the spike protein and the receptor of the animal cells? So to stop the fusion of these two key factors, we could stop the generation of the cell, the virus in the animal body. So the spike, the spike. The manifesto of the spike protein, after its death, we could make the virus spike protein to become the antigen of the vaccine. The log of on the membrane of the cell is the receptor. It's the ACE2. The coronavirus COVID-19 spike protein, their receptor is ACE2. The ACE2 manifests itself in the lung, in the kidney, and in GI tract, and also in the mouse, but not in the liver. So the coronavirus could infect a lot of our internal organs. So we don't see coronavirus in the liver. So as soon as the ACE2 get in contact with the internal organ, except the liver, the internal organ will be affected. So the patients who are infected with the coronavirus, they have symptoms manifested in their lungs, kidneys, and their internal organs. SARS and COVID-19, they both have ACE2, but the SARS, the power of attachment to the receptor, the spike protein attached to the receptor of the cell membrane is more powerful than the COVID-19. So the virus uses its spike protein ACE2 to open to unlock the receptor to enter the cell of animals. So the virus could also use the virus could use the cell, the membrane, the receptor on the cell to open up the cell. It's very intelligent mechanism. So we still cannot figure out why virus is so intelligent. It knows how to open the lock of our cell. So it's really hard to believe that this virus is man-made. What are the symptoms of COVID-19? 80 to 90% of the patients, they have mild symptoms, and the incubation period is 2 to 14 days, and they have so the symptoms are upper uh, respiratory tract infection, and also they have difficulty in breathing, and they have cough and stuffy nose, and they have, some people they have fever and fatigue and soreness in the muscle, and the fatality rate is 2 to 7%. And this fatality rate is the patient who are hospitalized. But if the patient with high blood pressure or diabetes, they have even higher fatality rate. And there is a very good research done now. There are researchers going to the remote area poverty, the area with severe poverty. They go in there to study the virus infection situation in the children. And the fatality rate is very, very low. It's only 0.05%. So that's fatality rate is very low in those poor village, and in children. But it's the fatality rate is so much higher in the elder people. So the transmission method of the coronavirus is if the spread of the coronavirus is if you get in contact with the person, you can get infected through aerosol transmission. The aerosol transmission could transmit the virus very far. And also there's possibility of droplet transmission. And COVID-19 is confirmed that it could transmit the virus by aerosol transmission. Aerosol transmission is confirmed. And also in our environment, there such as the metal, the smooth surface on the desk, the virus could exist about 6 to 7 hours. And how one are not how does how many people could be infected by after one patient who is infected with COVID-19, and how many other people would be infected by this infected COVID-19 patient? It's called the reproduction number. The reproduction number is so much higher than the SARS.
Another question that people often ask is about the RNA. RNA viruses can change very fast because there are errors in when they are being replicated, so they mutate quickly. Thus, their mutation rate is quite high. However, coronavirus may have error correction process that lowers its error rate. Currently, COVID-19 can still change into different forms. For example, the COVID virus that is spreading around the world has been changing. In this chart, we will see on the left side, the brown area represents the virus strain that has been spreading in Europe. We call it G614. And then in the old virus was called D614. And then on February 22nd, there's a new strain of the virus that we call G614 that appeared in Europe. And very quickly, it became the strain of virus that had caused the majority of the infections. Over a course of 2 months, this virus has changed and the antigens have changed. So viruses can change very quickly. So what does this mean for us researchers? Well, as we see, G614 came from D614. What caused this mutation? And because of this change, our immune systems cannot keep up with this change. And this causes us problems. In the future, can we produce an effective vaccine for this changing virus, or will they become ineffective? And now, as we try to diagnose for COVID-19, we do it by testing the RNA using PCR, which is a method for replicating the RNA to millions or billions of times the volume in a very short period of time so they can be studied. And this requires us to get a specimen from either the nasal cavity or from saliva. And this takes about 4 to 7 hours. And because of the process of getting the specimen is quite uncomfortable and requires medical staff to get the specimen from the oral cavity, and the patient may cough. So this puts the medical staff at very high risk of getting infected as well. And now we also have a rapid screening that takes about 15 minutes. We look at the protein of the virus from a drop of blood. We can also do it from the mucus in our oral cavity, and takes just 15 minutes. And the third method is to look for the existence of antibodies that can prove that the patient had been infected by COVID-19. So these are the 3 methods we are currently using to diagnose for COVID-19. So what we are pushing for is a rapid screening, testing for the virus protein in a drop of blood. This is the fastest way. So the WHO has announced that they will be producing 500 million rapid screening kits for developing countries, for countries with higher infection rates, and do a lot of testing to see how many people carry this virus. I think this is something Tzu can consider taking on as well, is to use rapid screening to test for the virus's protein and use this for diagnosis and see which countries and how many people are infected. So these are the three methods that we have currently for diagnosis. Now, COVID-19 is harder to diagnose than SARS because the virus can go from testing negative to testing positive. That can be a wrong result. It's a false positive. We see that people who tested negative in Taiwan go to other countries and then they test positive. And people ask, why did we not find these cases when they are in Taiwan? And so this has caused some stir in the Taiwanese society. They are doubting the diagnosis method in Taiwan, and that is causing some disagreement. We also see asymptomatic carriers continuing to spread the virus. So even though they are not showing any symptoms, they do in fact carry the virus. So what do we do with these people? Some of these people become super spreaders. For example, a few months ago, we saw in Korea, there is a religious group where one person was asymptomatic but carried the virus. So this person became a super spreader and infected a lot of people in that religious group with COVID-19. So this virus and its symptoms are not easily understood by most people, and it is also very different from SARS, because SARS, we can see the people who are infected do show severe symptoms, but COVID-19 can have asymptomatic carriers. So this makes diagnosis very problematic. There are a lot of places who are testing for antibodies for the virus. This will tell us if an individual had been infected by the virus and whether this person has developed immunity. So doing this test allows us to measure the degree of the infection in the virus and the degree of local transmission. And when a person recovers from an infection, the serum from their blood can perhaps be used for treating other patients. This because the antibodies in the serum can be donated and help other patients in their fight and in their recovery. So there are some organizations in the United States who are getting volunteers who have recovered from COVID-19 to donate their blood and use their serum to help other people. I've recently read in the newspaper that there was an experiment to see how many people in the Zhanghua area in Taiwan carry this antibody. It came out to be 0.085%. So this is a very low number and shows that Taiwan is quite safe. Now, the most important work, of course, is the development of vaccines.
So there's the main goal that we are focusing on our research is to attenuating the virus of the spike protein. So the attenuation of the virus spike protein to reduce the power of the virus getting into the to open up the cell. So the spike protein of the virus is to we could work on neutralize the we could neutralize the spike protein antibody, so to reduce the power of that it would attach to the receptor of the cell. So there are various methods that we use to work on developing the vaccine. And the Monera, it's used the RNA as carrier. This is the newest way to use RNA to do the carrier. And the developing period is about 3 to 4 months, so it's not fast enough to catch up with the widespread, the speed of the outbreak of the coronavirus. So we hope that we could speed up the development of the vaccine. We still face the bottleneck of the mass production and the development of the vaccine. The problem that we face is the neutralization of the antibody of vaccine is still not quite effective, and also the development of the terms of validation of the vaccine is still too short. So we still need to put in a lot of effort to do the research. And the clinical trial, as we don't have enough time to do the clinical trial. Usually, it takes 1 to 3. It takes a long time to do the clinical trial, and also the virulence of the virus is still quite hard to neutralize, and the principle of the treatment is to we hope that we could minimize the overreact of the cell, and the patient have the lung infection. The virus will cause the cell death of the lung, and the replication of the virus, its replication is very fast in the animal body. So we hope that we could also slow down the replication of the virus.
Finally, how do we protect ourselves against COVID-19? We need to follow instructions of the public health authorities, learn about infectious diseases, and also to understand the transmission routes for COVID-19. Of course, when we find people who are who have contracted the disease, they need to put into quarantine. We need to reduce our public gatherings, like canceling sporting events. And when foreigners come in especially from infected countries, we need to screen for them at our border controls and increase our social distance among each other. And finally, if there's a breakout, then the area needs to go into lockdown. And this lockdown is meant to prevent the collapse of the healthcare system. And this lockdown is unseen previously in history. It's the first time in history that we see governments preventing the free movement of people just outside of their homes. We also see some governments who are trying to build a herd immunity, such as Sweden and UK, but this did not prove to be effective. But when a country goes into lockdown, when to lift the lockdown is also something to be considered very carefully. So when will we be able to go back to our normal lives? Well, when we have enough vaccines for everyone, or when most people have been infected, that is greater than 60% of the people have been infected, then we will have developed herd immunity. And also, we hope to see the disappearance of this virus altogether, like SARS. So these are going to be very helpful in our fight to curb COVID-19, but this will not happen immediately. So in the future, we think that it is not going to disappear, because some viruses can escape the immune system and continue to live on in the body, such as in the nervous system. It can also become a seasonal epidemic where it keeps residing in some animals in nature and come out when the season is right. We are also hopeful in our effort to control the virus with vaccines and with drugs, and this is a direction that many countries in the world are working towards. Finally, we need to prevent contact with bats and their contact with other wild animals, as well as contact between humans and wild animals. I think this is something that Tzu Chi may be able to help with. We need to learn to coexist with the virus, so that because humans will never be able to exterminate the viruses, so we need to learn how to live with them. Thank you. Thank you, Dr. Lai.